And we turn now to health news. While black women have comparably diagnosis rates to non-Hispanic white women for breast cancer, they face a nearly 40% higher risk of mortality. Overall, black individuals have higher mortality rates across most cancers and the shortest post-diagnosis lifespan among all racial ethnic groups. Joining me and spending some time today is the board certified radiologist at RadNet. We've got Dr. Jason McCullough, and thank you so much for joining us, Dr. Jason.
Thank you so much for having me. It's an honor to be here.
Hey, well, thank you. And I wish we could have better numbers to talk about, but honestly, there are these disparities that exist. Talk to me about the findings and just your thoughts.
Absolutely. If you look across the board beyond breast cancer, the healthcare outcomes, when you compare African-American women and African-American men, for that matter, to the broader population, turns out to be a lot worse. So let's focus our conversation on breast cancer. Breast cancer happens less frequently in African-American women than it does in their white American counterparts. But despite that decrease in frequency, black women die at a higher rate. So the mortality of breast cancer in African-American women tends to be higher. And the reasons for this are multifactorial. Certainly there's some biological underpinnings of this disparity, but certainly there are social and environmental contributions as well.
When we talk about that, knowing that the mortality rate is higher amongst black women and blacks with regards to this, it's a startling statistic, but yet and still it's very real. How do we deal with this in terms of a couple of things? Number one is detection. When we talk about detection, sometimes detection comes at a late time. How do we deal with the issue of detection?
So technically speaking, there is no, quote, cure for breast cancer, but the closest that we can come to finding a cure is early detection. Finding disease at a smaller size and an earlier stage will equate to the equivalent of a cure for the disease for many women. So it's critical, especially in our African-American population, to have these patients imaged early and often. The average risk woman should start screening at age 40 and on an annual basis thereafter. But if women are at high risk, they could start screening at an earlier age and also get supplemental screening with such imaging studies as breast ultrasound and breast MRI. Just to carry on the conversation about the disease burden in African Americans as it relates to the larger population, African American women tend to be diagnosed with disease at a later stage and at a larger size. In addition to that, the biological makeup of the disease tends to be more aggressive, tends to grow and spread more quickly and be harder to treat. So it's of critical importance that African American women be imaged on a timely basis and repeatedly over time.
We talk about AI and the advancements of AI right now, but there is AI that's available when it comes to even dealing. So talk to us a little bit about AI and artificial intelligence mammography.
So artificial intelligence is this burgeoning topic that we're all talking about in various facets of society. In our world, EBCD, or enhanced breast cancer detection, is the newest technological advancement in imaging the breast, and specifically looking for breast cancer. EBCD is an artificial intelligent algorithm that essentially works in the background. It's an algorithm that looks for cancers. So when a patient comes in, they'll have a mammogram as they normally would, and that mammogram will be interpreted from a radiologist such as myself as it normally would. But with EBCD, there's an added layer of scrutiny. The computer algorithm will look at the imaging study, evaluate the imaging study, and scrutinize that study for breast cancer, and that provides an additional layer of scrutiny for the imaging exam. And what we found by appending artificial intelligence to our imaging paradigm, there's been a 20% increase in the detection of cancers. When you look across various patient demographics, it does so equally. So all races are impacted equally by artificial intelligence, and it's something that is a boon or a boost, if you will, for our ability to detect breast cancers, and certainly will be an advancement for women of all demographics, but especially important in this category that we're discussing today, in African American women, as the improvements have been seen equally across the board.
Yeah, and we know traditionally it's been said in African American communities and in non-white communities, there's always this questioning and this issue of health and health care, not really trusting going to the doctor. Some just don't have the means. And talk to me about how this plays out, because as we see these numbers and we see this this discrepancy in the numbers, some can attribute to the fact of care and really seeking consistent care, hearing from your doctor, and many times it's way after the fact before a diagnosis is made, but possibly could have been avoided.
Yeah, certainly there are social determinants of outcomes when it comes to breast cancer in African American women. For reasons that are beyond probably the scope of our conversation today, there has been some seed of distrust as it relates to the African American community and healthcare, and because of those transgressions in the past, there may be patients who are unwilling to seek medical care in a screening or a preventative way, much less when it's absolutely needed in an urgent or a more acute fashion. And for that reason, that provides another barrier for healthcare in the African American population. And I think the key to addressing this is education. Knowledge is power, and the more that African American women know about themselves, their health, and preventative interventions such as screening mammograms, I think that goes a long way in terms of addressing the disparity in outcomes as it relates to breast cancer mortality.
Yeah. We also know that Black women are more affected by aggressive subtypes, and we talk about TNBC and inflammatory breast cancer. Break that down for us.
That's correct. So when you look at the biology of cancer tumors and the cell types, triple negative breast cancers are more prominent or more common in African American women who are diagnosed with breast cancer. What this basically means is, on the surface of the cells of these tumors, there are various markers. Two of them are related to hormones, progesterone and estrogen, and another is Herceptin. These are three markers or cell surface markers that occur on the surface of these tumors. And these provide treatment targets for medical therapy or medical oncology. In triple negative breast cancers, there are no receptors, and that makes the disease harder to treat. There are just no treatment targets for our medical therapeutics to attack, if you will. In addition to that, when you look at the outcomes of these tumors, they tend to be more aggressive and harder to treat, as I'd mentioned, and are associated with increased mortality. So looking at the population, African American women are in a disparate way more prone to getting triple negative breast cancers than their white American cohort.
Yeah. Dr. McKellop, we're going to have to leave it there. Dr. Jason McKellop telling us a little bit of what we need to know, board certified radiologist of RadNet. Thank you for being with us.
Thank you so much for having me.
All righty. Well, now, if you want more information, please visit the website breastlink.com, and then also radnet.com. We encourage you, please don't go anywhere. We got more open coming up right after this.